First Contact Clinical is a social enterprise in the North East. We strive to make a difference to the health and well-being of disadvantaged people and communities by enabling healthy behaviour change. We specialise in delivering person-centred, community-based behaviour change services and skills training to people and professionals. Our frontline work shapes what we do. The NHS 5-year forward view set out a central ambition for the NHS to become better at helping people to manage their own health, staying healthy, making informed choices of treatment, managing conditions and avoiding complications. Evidence tells us that supporting patients to be actively involved in their own care can potentially yield efficiency savings for the system. Our proposal was informed by our work with people with addictions. The combination of psychosocial interventions with evidence-based clinical care is considered normal best practice in this particular long-term condition. We were struck that this is not the case in others, where care is predominantly delivered by medical staff whose focus is primarily on the physical consequences of the illness. Our team for this project was small but strong, with multidisciplinary backgrounds covering everything from physio to psychology. The experience and knowledge of our team really lent itself to embedding us as added value into practice teams. A key part of the service design is its integration into existing primary care services, particularly the GP practices. Our Pathfinder practice was Trinity Medical Centre, and we spread into Flag Court. Both practice teams have been enthusiastic from the outset. Collaboratively with practices, we began to explore the current pathway for patients living with COPD and look at where this service could sit within that. It was important for us to be an add-in service rather than a bolt-on addition. NHS England proposed that activation sits at the heart of self-care support. Activation describes skills, confidence and knowledge to manage their own healthcare and can be measured using the Patient Activation Measure, PAM. Evidence suggests that higher PAM scores correspond to better health outcomes, better experiences and more appropriate use of resources. People enter our project as part of their long-term condition review or following a new diagnosis in primary care. The intervention is based on their PAM score. People are offered stepped care approaches to psychological interventions, ensuring those with the lowest PAM scores are offered the most intensive intervention. For example, the most activated people at level 4 will be signposted into the community, while someone at level 1 is offered one-to-one coaching sessions. In the early months, the data showed that we were spending more time with the activated people, as they were easier to engage, more willing, or in some cases more demanding. We had to consciously ensure that the intensity of the intervention was weighted towards the less activated. Data now confirms that we are providing a proportionate response. The most in need are getting the most coaching time. I'm going to share one of our case studies, Amy. She came to see us with an initial PAM score of 55.6, level 2. She was overwhelmed. The house was damp, exacerbating her condition. Family situation was delicate, with children in care and access difficult, and despite previous attempts to quit smoking, she was still smoking around 40 cigarettes a day. Amy decided to address her housing issues first, as these were having the biggest impact. Money was tight, so we signposted Amy to the Greggs Foundation, who offered a grant for the purchase of beds for the children. With the family reunited, Amy's confidence was boosted. Our link worker spent some one-to-one time with her to build self-esteem and confidence to attend therapy sessions and our mutual aid group. Following one-to-one support, Amy attends those sessions with a trained counsellor. The housing situations are resolved and the children are regular visitors. Amy started supporting the facilitator at mutual aid and accessed local stop smoking services to become smoke-free. She's a completely different person, much more confident. That was from her practice nurse. This graph shows changes to PAM for those people who had an initial PAM of level 1 and 2 on entry to our service. An upward trend in PAM shows improvements in activation, with many people jumping levels as well as increasing their point score. As we fine-tuned our intervention technique and attracted more patients, we began to see bigger improvements in PAM scores. We were keen to see if our initiative would have an impact on GP survey results. We surveyed people who had been open to the service in the last 6 months and were PAM level 1 or 2 on entry. 29% of people responded. 80% of them said they felt they had enough support from local services to manage their condition. 73% of them were confident in managing their own health. Data shows that appointments reduced by 24% when we compare 8 months before the intervention began and 8 months following. We also measured the number of packs prescribed in the 12 months before our intervention and since our intervention in our longest running practice. This showed a reduction of 3% in prescriptions of rescue packs. South Tyneside is a rich community with assets supporting residents around a wide range of topics. We have agencies who offer advice, groups, activities and more. From green gym initiatives to national advice services, we have signposted our clients more than 230 times to over 50 organisations.
I've been through stressful times like packing and smoking. I managed to do it and stop the cigarettes and then getting under control my condition. I've got a lot more confidence as well. I'm doing a lot more exercise. Yes, I'm walking actually up to an hour a day and the staff are very helpful and supportive. We're going to laugh out of it.
We supported members of our client base to set up a regular mutual aid group. More than a coffee and a chit-chat, this group really supports one another to find solutions to problems, learn new skills and have a little bit of fun along the way. Last year, the group decided to donate Christmas food parcels, recognising some members were less fortunate than others at an expensive time of year. We have funding to continue for a further 12 months and we've spread into another 3 practices. We also have support to spread to patients who have been diagnosed with diabetes in the last 12 months who have not attended structured education. We are actively working with commissioners to offer this intervention across the borough to all people with long-term condition and others who would find it useful. We have worked closely with our practices to identify groups of potential clients who would benefit most from the coaching service. These tend to be persons who are costing the system in time, money or future healthcare needs. Our challenge is to continue identifying these groups for all surgeries. The people who have the most to gain from this aren't the people who seek out the service.
They're all nice people and like you get little snippets of information.
30 years. I have not been outside the door.
I wasn't used to being in groups.